A lumbar microdiscectomy is the operation we do for a severely damaged disc. This video will provide you with basic information you need in understanding the procedure. It should be noted that a proper diagnosis and its proper treatment are your and your doctor's concern. Let's begin by taking a look at the anatomy of the back. The spine is made up of three main regions. The cervical spine contains the first 7 vertebrae and makes up the neck region. Next is the center portion of the back, known as the thoracic spine. It contains the next 12 vertebrae. The third section of the back is the lumbar spine. This area makes up the lower back and contains the 5 largest segments of the spine. Between each of these vertebrae are circular pieces of cartilage called discs. The final area of the anatomy that we would like to point out is the sciatic nerve. This is the long nerve stretching through the muscles of the thigh, leg, and foot and contains many branches. The first question you may have is, what is a lumbar microdiscectomy? A lumbar microdiscectomy is a minimally invasive procedure designed to relieve the pressure on your sensitive spinal nerves caused by a herniated disc. It's the pressure on the nerves that's causing your leg and buttock pain that makes it difficult for you to walk and sit. A microdiscectomy begins with a small incision, usually 1 or 2 inches. In the next step, the irritated nerve is carefully moved out of the way and the herniated portion of the disc is removed using fine surgical instruments under magnification. Very little, if any, removal of bony vertebrae is necessary. Only the part of the disc that is pressing on a nerve and causing pain is removed. Generally, only one level of the spine is involved. The operation takes about 45 minutes to an hour and will be done under general anesthesia. Keep in mind that with modern anesthesia, you will be safe and comfortable. You will be awake and alert about 1 hour after your surgery. Even though disc surgery offers excellent prospects for recovery, it's important to remember that you should expect improvement, but not necessarily complete relief. Your disc was damaged at the time of your injury, and it is impossible to recreate a completely new disc. A main concern with anyone facing surgery is the possibility of complications. You'll be happy to know that complications after lumbar microdiscectomy are uncommon. Because no surgery is risk-free, however, let's discuss some possibilities that may exist. Infection is always a risk with any surgical procedure. Lab work will be performed to check your health condition before surgery is seriously considered. This lab work detects conditions such as heart disease, high blood pressure, and diabetes that need to be taken into account when planning your pre- and post-surgical care. Extremely rare but serious complications include heart and lung problems, bleeding, nerve damage, spinal fluid leaks, excessive scarring, and recurrence of the herniated disc. Your physician will be taking great care to reduce the risk of all these complications. Generally, you will be discharged from the hospital the day after surgery once you've been out of bed and walking. Once at home, you need to avoid sitting and gradually increase your walking. In addition, you can do simple knee to chest exercises to help your back muscles heal. Most people who are considering lumbar microdiscectomy are eager to know how long it will take to get back into the swing of things. Progress after surgery varies with each person, so keep in mind that these healing and recovery times represent average experiences for our patients. Most patients can drive in 2 weeks. Physical therapy may begin 1 to 2 weeks after surgery and can continue for approximately 1 month. By 6 weeks after surgery, you should be well on your way to recovery, able to take long walks, and in general, enjoy your favorite activities. Advances in techniques and instruments have made modern back surgery a positive solution to herniated disc problems. Lumbar microdiscectomy is a time-tested, safe, and effective procedure that has helped thousands of people regain a healthier back. We know the decision to have surgery is a stressful and important one for you and your doctor to make together. We hope this presentation has been helpful and you have a better understanding on which to base your decision. If you have any other questions, please be sure to ask your physician. The subject matter discussed in this video presentation has been reviewed by board-certified orthopedic physicians. Because each case is different for each patient, please consult your physician for the appropriate diagnosis and treatment.